Hi, I'm here to pick up a prescription.
Okay, is this prescription for you or for someone else?
It's for me.
Okay, what is your name?
Mary Moore.
Mary, hi, it's nice to meet you. My name is
Hi.
Michael. I'm the pharmacist who filled your prescription. If you have a moment, I'd like to take some time to talk to you about your medication so we can see how we can make sure to have it be used as safely and effectively as possible.
Yeah, that's fine.
Okay, please step over here. So before we begin, I want to take a moment to look at your profile and make sure everything we have is up to date and accurate on you. So,
Okay.
What is your date of birth?
July 4th, 96.
Okay, it looks like we have everything accurate here. And does this address and phone number match the one that you still use?
Yes.
Okay, excellent. I also want to check to make sure that there aren't any new allergies. Do you have any new allergies?
No.
Are there any new medical conditions that I should know about?
No.
And are you using any other medications that we don't have on file?
Just my birth control.
Okay, and does that include any over-the-counter medications or herbal supplements?
I'm not taking any of this.
Okay. So the prescription that we have here is called Detrol LA. And have you ever taken Detrol before?
No.
Okay. What did your doctor tell you that it was for?
I'm too embarrassed to say.
That's okay. You can take your time. Many of my patients have found that they're embarrassed about their medication, but in full honesty, things happen to everyone, and it's okay.
Yeah. Well, I guess it's for my problem.
Okay. I believe I understand. If it's okay for me to say, the medication is generally used for an overactive bladder, which is a problem that actually affects many people, and there's nothing to be ashamed about. And what this should do is if you take this medication, it can help that problem go away. And so if that's something that you're interested in, then I definitely suggest sticking with the regimen.
Okay.
Speaking of that, when you met with the doctor, what did they say that you were supposed to use it for? Like how are you going to use it?
He didn't really tell me.
Okay. So on this prescription here, and this matches the recommendations that I often give to my patients, you're to take 1 capsule by mouth every day with water.
Okay.
So what you'll do is you'll take the capsule out, don't crush it or chew it, and you
Okay.
put it in your mouth and drink it with a full glass of water.
Okay.
And the reason that we recommend that is because this medication can be a little dehydrating and can give people some things like dry mouth and certain other side effects, because what it does is it helps prevent, excess urination, and that can also help dry you out in other places.
Gotcha.
Speaking of that, what side effects did your doctor tell you to expect?
He didn't really say.
Okay. The most common side effect that we run into is dry mouth, like I said, and that's part of why we talk about taking it with a full glass of water. But it's important to stay hydrated throughout the rest of the day as well. You can also run into some situations where there's constipation or blurry vision. Those hopefully won't be a problem for you. They're not a problem for everyone, but it can happen. And if it does happen and it concerns you, go ahead and give me or your doctor a call. My name is Michael again, and my number is here on the top of this bottle, as well as on this patient information sheet that I'm going to send home with you.
Okay.
And I do want to let you know about some more severe side effects. These very rarely happen, but they can be serious conditions. So if you find that taking this medication causes you to have like a clouded head and confusion, or you get an irregularly fast heartbeat, those are things to perhaps be concerned about.
Okay.
And if those happen, I want you to call me or call your doctor right away so we can figure out what we need to do to make sure that it doesn't get any worse.
Okay.
And this will help with the excess urination, but it's possible that the dose may be too high. And if that happens, and 4 milligram capsule shouldn't be the case, but you never know. Some people do find that the dose needs to be a little lower. And in that case, we want to make sure that you don't have difficulty urinating. So if you do, that's another thing to call about, and we'll get that figured out. You have 2 refills on this medication, so if when your 1 month supply is up, you can come back and get more.
Okay.
And we'll get that filled out for you. And when you store this medication, it's good to keep it out of bright light or moisture. So if you can, try not to store it in the bathroom.
Okay.
And I recommend taking it at the same time every day just so that you remember. And so, perhaps first thing when you get up in the morning with a full glass of water is not a bad idea. I've covered a lot of information, and I want to make sure that, I was able to communicate everything as effectively as I can, because I know that some of this can be overwhelming. How is it that you plan to take this medication when you get home?
I'm going to take 1 pill, and I'm going to drink a full glass of water so I won't get like a dry mouth or anything.
Absolutely. So that is exactly what it is. It sounds like you have a pretty good understanding of the situation. Before we go, I just want to give you a chance to ask me any questions that you might have.
Well, you're not going to share this conversation with
Absolutely
anyone,
not.
are you?
No, the trust between us is important to me, and it's not something that I'm going to share with anyone, and you shouldn't have to either unless you're comfortable.
Okay, thank you.
Okay, so once again, my name is Michael, and my contact information is here. And thank you for coming in, and I appreciate you being candid with me.
Thank you.
I saw the timer.